fibrosis is a genetic condition that requires the maintenance of a demanding daily regimen. Remote monitoring of key health metrics could reduce the need for patients whose health is otherwise stable to attend routine in-person clinics, as well as reduce the delay of treatment for those who need it. Though the uptake of telemedicine in CF has proven challenging, real-time data transmission to clinical teams, tracking lung function via an internet-connected spirometer, games to increase adherence, and an iPhone tool to enhance CF-related knowledge, treatment adherence, and peer support have all been shown to be beneficial to CF patients. Along with low adherence rates, other barriers to the use of telemedicine in treating CF include mutual independence involving the patient and clinical staff, and the co-interpretation of data involving patients, clinical staff, and other caregivers. Though this type of specialized home care has not been fully integrated, there remains significant optimism around the use of these technologies due to the perceived benefits for both patients and clinical teams.
Technology can help with dealing with burdensome cases such as reminders to help prevent forgetting CF medications showed in the studies. Examples include such as notes, reminders, alarms, and glucose monitors to measure diabetics. Another thing regarding CF patients is being aware of their diagnosis. Most CF patients don't consider themselves patients outside of the hospital. This could result in decrease of caring for their treatment and neglect in caring for themselves. Mandatory CF clinic check-ins are every 3 months, which takes long periods of time and even longer if the patients experience an exacerbation or infection. CF, being somewhat of an immunorepressant, results in the higher chances of cross-infection. Loss of lungs due to direct contact, which cause damage to both the patient and the hospital. Inconvenience. This could result in inconvenience to patients, even though it is important for them to attend to the hospital. Hospitals also have made it mandatory not to schedule appointments for those with different bugs in the same clinic, even though consistent control precautions are placed.
The CF home monitoring device should be passive monitoring, which help patients to have less burden and be more health aware. This leads to change in behavior and better health condition. I think the device should use day-to-day vocabularies for patients to better understand their personal data. Also, passive monitoring helps for many patients who want to disclose the presence of CF in their lives. Patients don't want to think about CF all the time, and they don't want others to know about their illness. Some challenges related to clinics are, first, burden for patients to visit hospital routinely, where they have to wait long and may lead to an inpatient hospital stay. Also, a danger of cross-infection is present. Clinics try to make cross-infection impossible, but it does not guarantee 100% germ-free. This scheduling and restriction for patient visits reduces capacity of the clinics.
Another challenge with CF clinics is that there is limited opportunity for clinicians to build trusted relationships with their patients due to the minimized interaction. Developing trust relationships with patients is really important to understand contextual factors in their lives which can affect their health and treatments they get. The wearable and home-based technologies can be used to overcome these challenges. They support interactions between patients and MDTs. Early identification and treatment is crucial in a patient's health. Home spirometers, oxygen saturation meters, and wearable technologies such as fitness trackers collect data, and clinicians can remotely monitor core health metrics of the patients with this data. These home monitoring technologies are for extended care rather than self-management. Wearable and home-based technologies can be integrated into CF care system in 3 core categories: data augmentation of existing clinics, remote triage, and remote clinics. However, there are some concerns too because it can increase the burden of CF patients at home, or there can be a data overload. To make the best use of remote monitoring technologies, they have to be well integrated considering both patients and clinicians' perspectives.
This article highlighted many important factors that may impact cystic fibrosis care provision. First being that those who deal with cystic fibrosis already have so many burdens on their life that adding some form of data collection to their regimen could be imposing additional work that they may not want to take on. The second highlighted factor was the patient's resistance to such an activity, as it would only worsen their feeling of being defined by their disease. It's easy to become consumed in treatments, which can be very dehumanizing. Frequent data collection is like a constant reminder, adding to that dehumanizing factor. However, I believe it's still important to collect data in hopes of finding means of improvement. Therefore, in the end, I think that it's left up to the design and method of data collection to humanize the process so patients can feel less like test subjects. While this article discusses telehealth, there are many potential benefits. Greater convenience, broader reach, increased efficiency, so on. However, as the article states, one of the greatest setbacks is the fact that most patients prefer face-to-face consultations. However, I think this is a fear that will be phased out through the next few generations, and I think the benefit of telehealth lie in the increased speed of advice delivery it will provide. It will come in handy for many urgent situations.